I'm excited about real-world evidence feeding back to the biology and then the biology feeding back to the real-world evidence in some sort of loop. We've been chasing this learning healthcare system dream for a really long time. I think that some of these ML and AI systems that we're talking about here today can finally start to make that linkage possible.
I'm joined here by 4 leaders at the intersection of data and AI. How do you benchmark whether someone has anxiety or depression? Whether you benchmark whether it's ADHD or OCD or what do they have? I think clinicians themselves are unsure. Creating these benchmarks seem impossible.
Yeah, I mean, you could definitely benchmark against like individual experts, right? So you can sort of get a bunch of humans to label something. It won't be a perfect benchmark. Humans are wrong sometimes, but I can push that number up until I get to human level. You can also do collections of people and take like a majority vote, but at some point it's going to be pretty hard to like get to the fundamental ground truth.
The way that we've done this at Centaur is we've built this huge network of medical students and doctors and subject matter experts around the world that are competing with each other to prove that they're the best at tagging data according to whatever protocol it is that our clients want. There's still going to be a scaling problem no matter what you do, but I think there's clever ways to unlock the collective intelligence of people around the world to tag data for new use cases.
The large language models can give us the summaries of the documents that we write down our biological results in journals. But connecting biological ground truth to health ground truth is often pretty hard. But when you're able to do that, you can get really interesting results. Like I was talking to a scientist last week who is able to go from RNA-seq to predict histology slides, and vice versa, right? To go from histology and predict transcription. And that's because that lab was able to generate the foundational join data that let them train on it, because the model itself is just a basic model. So I think a lot of this is about being intentional about designing the training sets that do the connection of the fundamental biology to the healthcare space. Because then everyone who's on the stage who's not me can actually run models. On the biology side, we've kept so much of that knowledge creation process in the academic sphere, and we've not ever co-located that inside the hospitals or the research systems. And so one of my dreams is that the big biobanks at the big hospitals start to be connectable to the healthcare systems that they were captured in.
Wow.
And create those feedback loops.
Nick, pre-training is basically this promise that if you fed it more, right, there are no diminishing returns, and you unleash it in a clinical setting, could it have benefits?
Yeah. So there are definitely diminishing returns on pre-training, but there are like continuing returns to scale. I think the main challenge is data here, where for something like text, if you want to get really good at writing essays, that sort of thing, like there's a huge amount of data there, and you can sort of pour more and more compute in and get like continuously better at this as you do that. Once you get to stuff where the data is like locked down for privacy reasons, for legal reasons, for commercial reasons, it gets much harder. I think most people, if you break your arm, you go and you get an x-ray, you don't immediately think, wow, I'm going to go post this on my website and properly caption it so everyone can train on it in the future.
So Othman, there is now a fork in the road between large models that are very good with scaling data and compute, but also the need for a more bespoke clinical setting. And so how should we tackle this fork in the road?
The world doesn't necessarily converge towards a global consensus. Like, we did not believe that you would be able to have one single model to rule them all, that will have healthcare superintelligence, and then all doctors across all health systems will delegate to that, because even a simple question like, at what age should a woman get a mammogram, that answer might be different in the US versus France. And so the work we've done there is to create an architecture that pairs, on one hand, the language model with an architecture that injects into it a fully declarative way to look at the actual decision-making within a single context so that you can structure it. Yeah, exactly.
You've got lots of companies developing models and starting to deploy those by lots of people here. There hasn't been that much thought into what happens once they're deployed and how you continue to make sure that these things work and that they're working as intended, especially as you deploy them into different settings. So something works at Stanford Hospital and it doesn't work at the community center across the street. Even if you deploy it and it works on day one, the world changes. You need to make sure that the model continues to work, and there's not really any way to do that other than to have a continual evaluation and monitoring regime.
So in the last few minutes, I'd like to kind of end with a prediction game. What do you predict with certainty is going to happen in the next 6 months and with greater than 50% probability in the next 2 years?
The answer to both is something that we're seeing a lot of is health coaches. And even my relationship with ChatGPT is starting to have this more ongoing health coach relationship.
The intelligence side of healthcare that like lots of people in the US can get pretty readily to like be accessible extremely cheaply, like kind of across the world. One of the things I'm like most excited about as AI gets better and better is it's like extremely cheap and extremely accessible to a large number of people.
Long run kind of chats that have your full health record in context, the equivalent of like, deep research, but with having your full health record in that conversation. There'll be a number of health areas where like world-class kind of reasoning and expertise really feels abundant. Like in the same way that today, like Google search has made it feel abundant to access general information.
All your predictions are people, not places. So they're like predictions about technology that the masses will use. I think a lot of people are cynical about the pace institutions are going to move, but people are really eager for AI. Thank you. I've really enjoyed our conversation. Thanks so much.